is a 65-year-old female, status post right MCA CVA. Analysis of her gait reveals left hemiparesis. During initial contact, she displays decreased left dorsiflexion with foot flat and lean to the right. During loading response, she has decreased weight bearing on the left side and genie recurvatum with external rotation of the left lower extremity. Unequal weight bearing is apparent in stance phase with the patient bearing more weight on her right lower extremity than her left. Left knee hyperextension is also evident in mid-stance. Terminal stance includes decreased left hip extension resulting in inability to place the left hemiparetic leg in a trailing position. The tibia fails to translate forward and the left foot fails to push off. During pre-swing, the patient displays weak left dorsiflexion leading to left hip external rotation. There's decreased left hip flexion due to the decreased flexor burst. During initial swing, there's left toe drag due to dorsiflexor weakness and lateral lean to the right, decreased pelvic motion, and decreased left knee flexion to carry through. The toes continue to drag through during mid-swing, and shorter step length is apparent. During terminal swing, the left hip fails to completely follow through, and the left knee fails to extend completely, along with left decreased dorsiflexion resulting in inappropriate foot placement. All right, Myrtle, what we're going to do now is we're going to do an activity with what we call E-stim. Do you know what E-stim is? It stands for electrical stimulation. And I know it sounds a little weird, but basically what we're going to do is we're going to put these little sticky pads on your skin, and you're going to kind of feel like a little buzzing sensation, but it should be comfortable, and we're going to try and get this muscle here to contract to lift those toes off the ground. Okay, that'll help with your gait, and it'll help with what we're doing, which is we're going to do some step-ups. So to help you clear your foot to step up on here, okay? So is it okay if I apply these on you? Yeah. Okay. So what I'm going to do here is I'm going to just kind of palpate around, look and see if I can get right over that muscle belly there, okay? I'm going to apply one about 2 inches distally to that. Okay, let me turn it on here. Alright, tell me when you can feel it, but it feels comfortable, okay?
I can feel it.
You can feel it? Is it comfortable?
Mm-hmm.
Okay, I gotta look for a visible contraction. Okay, good. Alright, that's where we're gonna start. So what's gonna happen here is it's gonna kind of ramp up. Do you feel it kind of ramping up? And you can feel a contraction?
Mm-hmm.
Yeah? Okay. When you feel it ramping up, I want you to step up on this step, okay? And then when it ramps down, you step down. Okay?
Okay.
So I want you to go ahead and kind of stand up like you normally practice. So go ahead and stand up, reach far forward. Good job. Alright, and then when you feel the contraction, I want you to step up on this step, okay? Using this to help keep you balanced, and I'll be on this side. Okay? So do you feel it contracted? Alright, go ahead and step up. Good job. And when it ramps down, step down. Good. When it ramps back up, you step back up. Good job. Step back down. Good, let's try 3 more. Good job. One more. Good job. All right, now slowly sit down here. Good job. All right, Myrtle, since you were able to sit to stand so well, we're going to try gait again, okay? So what I'm going to do here is I'm going to put this ACE wrap on your left foot here. And it's going to kind of help keep your foot in more of a position like this, so you kind of don't drag it when you're walking. Do you notice that you drag your foot when you walk?
Mm-hmm.
All right, we're going to try and address that today. So what I'm going to do is I'm going to lift your foot here. I'm going to wrap it around just a few times. I want to make sure it's nice and snug, but not too snug, so you let me know, okay?
Okay.
Let me get these 2 little pins here. I'm going to do next, Myrtle, is I'm going to take this one. I'm going to kind of attach it to the one down here. And what I'm going to do with this is that I can kind of help control your foot when you walk. Okay, so I want you to show me how good you can go from sit to stand, okay? So on the count of 3, can you move this foot back a little bit? Good job. On the count of 3, we're going to stand up, okay? Ready? 1, 2, 3. Good job. All right, go ahead and grab that cane with your right hand. Good. Okay, so what I want you to do now, Myrtle, is I want you to move the cane first. Then I want you to move this leg. So can you help me move it? Good. And now I want you to move that right leg far out and touch my toes here. Good job. And now we're going to move the cane again. Let's move this left leg. Good. And now that right leg. Good job. And the cane. And left. Good. Good job. All right, Myrtle, go ahead and move the cane. Now your left foot. Good. And your right foot. We're going to go around this yellow ball up here on your right, okay? On the right side of it. Good. Is this easier than how you were walking before? Yep. Yeah. What I want you to do is I want you, when you're walking, I want you to move the cane first, then your left foot, and then your right foot far out in front of you there. Far out, right here. Left foot. Now get that right foot out here. There you go. Good job.